is Misty Lewis. I'm the stroke coordinator at Hazard ARH. I have been in this position for 6 years now. Some of the key signs and symptoms of a stroke, we normally would use the Be Fast mnemonic, and that's balance. It's a sudden loss of coordination. E stands for eyes, that's blurry vision, double vision, loss of vision. F is for face, that's facial asymmetry. We look for droopiness. When the patient smiles, does one side of their face come down? The A in Be Fast stands for arm. Is one arm weaker than the other? S is for speech. Speech is slurred speech, trouble speaking or understanding. T is for time. And when we're talking to the public and educating about Be Fast, it's very important to know that time is everything. The faster you get to the hospital is the faster that we can act to help you. It's important for people to be aware of the signs and symptoms of stroke because, again, it goes back to time. If you can get to the hospital, we can administer a clot-busting drug if that stroke is caused by a clot. Also, if you have a clot in a large vessel in the brain, then we could transfer you to a facility that does a thrombectomy. And that's where they manually go in and extract the clot, and that's the best relief for that patient. The most common risk factors for stroke, especially in Eastern Kentucky, smoking is number one, hypertension, and then you have diabetes. Recovery is long, it can be exhausting, it's a lot of therapy. Physical therapy, occupational therapy, speech therapy, and we can't forget mental health. Sometimes with strokes you have depression or what we call emotional incontinence, and you may actually need to seek mental health therapy. If I could teach everyone one thing about stroke, it is time. With stroke, you do not have time to waste. Time is brain. The longer it takes you to get to the hospital, the more that actual infarct is expanding until we can give a medication to stop it. To me, serving my community in this role has been an absolute pleasure. We're treating our neighbors, we're treating our families, and we're treating our friends. And it means a lot in Eastern Kentucky when you can get top quality care close to home, and it reduces the burden on the families.
Be fast when you suspect a stroke. Call 911 and get to the nearest ER. ARH, more for Appalachia.